Alright, hello. Today I'm going to be performing cleaning / irrigating and wound care removal, wound care dressing removal and replacement. So first, before any procedure, obviously we're going to verify the order for wound care, make sure that's what we're needing to be doing, providing privacy for the patient, introducing ourselves, explaining the procedure to the patient, and then obviously gathering the equipment. So today I've got just an example little wound care thing here, and I've got an ABD pad, and then some gloves, and then I've got this sterile field right here, just some goodies. Then we're gonna assess the patient with 2 identifiers on the wristband, name and date of birth. Can I get your name and date of birth? And then before the procedure starts, we're gonna assess for any pain. So if the patient is in a lot of pain, we're gonna have to probably give them some pain medication before we start the procedure. So probably give that 30-45 minutes before, just to kind of increase the comfort for the patient. Next, we're gonna remove the soil dressing first. So, removal of the soil dressing involves a lot of things. First, you want to expose the area where expose the area that you're gonna work on, while still maintaining dignity and compassion for the patient by covering up all their other parts. And then you're going to obviously apply clean gloves on. I've got clean gloves on already, but you're going to apply the clean gloves on. We're going to loosen the edges. We're going to loosen the edges of the tape, kind of like so, over the wound. Pretend this is like over the skin, though, not over the ABD pad. And then we're going to gently hold the skin down with one hand, and then slowly peel off the tape, so to not do too much to the skin that would harm it in any way, or minimize the damage to the skin. After you're done gently removing all of the tape around, working obviously from the edges of the skin to the center of the skin, you're gonna remove the dressing that's on top. Now, if there's some resistance on the dressing, you're gonna want to, I'm just gonna say this is our saline today. You're gonna want to slowly moisten up the pad a little bit, to kind of loosen up like all of the exudates and stuff that's underneath, and then you're going to want to just gently pull it off, exposing the wound. Before you discard the pad, though, you're going to want to make sure that you assess like the pad for like any color, odor, drainage, any different kinds of fluids that would be coming out of the wound, and making note of that for documenting it all later. And then you're gonna obviously discard the transparent thing the proper way, and then you're gonna remove your gloves and perform hand hygiene. Next, we're gonna prepare to cleanse the wound and apply a new dressing. So what that involves is obviously donning the appropriate stuff that you need to don, and then you're gonna want to open up your sterile field. So I just have this kind of normal pad here with some gauze there. So we're gonna first obviously prepare the clean field, apply new gloves, clean gloves, and then how we're going to do this is we're going to irrigate the wound. We're going to irrigate the wound with our normal saline, working from the area of least contamination to greatest contamination, providing slow, continuous pressure to flush the contents of the wound out. And then we're gonna also have we're gonna prepare like a little saline tub to put our gauze in before then cleaning around the wound with the gauze. So when we're cleaning around the wound, if needed, we're gonna clean on the wound in one stroke. After that one stroke, you're gonna have to discard the pad that you just used. Never go over the wound and then go back over the wound again, because it'll recontaminate the wound. So whenever you're using a gauze pad, just have one stroke and then cut it off, or throw it away, get a new one. And then obviously after you're all done cleaning and irrigating the wound, you're gonna want to dab the wound, of course, with the thing only once, and then you're just gonna want to dab it, discard, dab it again, keep doing that. And then we're gonna assess the wound after that. Look for signs of tunneling or undermining, seeing if there's infection, if any purulent drainage is being produced, making sure everything's all good there. Also assessing around the wound, so making sure that if there's what is that called? If there's like where the skin kind of goes into the wound. But yeah, making sure the skin around the wound is intact and it's not also getting inflamed, which would make the wound bigger. So now after all that procedure is done, we're gonna discard everything, discard gloves, take away your gloves, perform hand hygiene, put on new gloves, and now we're gonna put a new pad over the site. So when we're putting the new pad on the site, we're gonna wanna make sure that it's in the right spot, it's comfortably over the patient, making sure that it's securely fit, and that we secure the pad properly with our tape, because if we don't tape it up properly, then contamination can get back into the wound from the outside. So we gotta make sure that we tape the wound properly. And then after that, we're gonna label the dressing with our initials, date, time. And then after that, we're basically all done, and then we'll remove everything off of our hands and stuff, and then we'll document every care that we did. We'll document, make sure the patient's comfortable, doesn't need anything, and then document everything that you did. And that's all. Thank you.